This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here, and today we are diving into the nuances of intraoperative mapping and patient outcomes.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the British Journal of Neurosurgery, published in 2026, titled Spontaneous Speech, a robust measurement before, during, and after awake brain surgery in patients with glioma.
This is a topic close to the heart of any functional neurosurgeon. When we talk about glioma surgery, particularly in eloquent areas, our primary goal is the balance between maximal safe resection and the preservation of quality of life. For these patients, language is everything.
Exactly, Dr. Aris. The paper highlights that patients with glioma often report language complaints that have a truly devastating effect on their daily life. Even if they can pass a simple naming test, they often feel their communication isn't right. This study looks at whether analyzing spontaneous speech can help us better understand those underlying language problems.
Right, because the traditional gold standard in the OR has often been standardized language testing, things like the Boston naming test or simple repetition tasks. While those are objective, they don't always capture the complexity of human communication. Ilara, what did the authors propose as the main utility of spontaneous speech in this perioperative window?
The authors aim to investigate spontaneous speech across the entire surgical timeline, before, during, and after the procedure. They argue that spontaneous speech monitoring is of vital importance during awake brain surgery because it can directly guide tumor resection and contribute to maintaining language function in a way that discrete tasks might miss.
It's that real-time feedback loop. If I'm resecting near the arcuate fasciculus or Broca's area, and we are just doing object naming, I might miss the subtle slowing of syntax or a loss of fluency that only shows up in natural conversation. The paper calls it a robust measurement. Did they specify what they meant by additional value compared to our standard tests?
They did. The study emphasizes that spontaneous speech analysis provides a more holistic view. Standardized language testing is often categorized into pass or fail, or specific error types, but it doesn't always reflect how a patient functions in a real-world setting. By analyzing the flow, complexity, and content of spontaneous speech, the researchers found they could pick up on those devastating daily life complaints that standardized tests might overlook.
That's a critical point for the residents listening. We often see a patient postoperatively who can name a pen, a watch, and a key, but their family says he just isn't talking the same way at the dinner table. This study suggests that if we monitor spontaneous speech during the resection, we might be able to prevent those subtle but life-altering deficits.
And that brings us to the intraoperative phase. During the awake portion of the surgery, the study notes that spontaneous speech acts as a continuous monitor. Instead of intermittent testing, the patient is engaged in a dialogue. This continuous stream of data allows the surgical team to detect fluctuations in language production immediately as they approach the functional boundaries of the tumor.
It essentially makes the patient's natural voice the GPS for the resection. Now, let's talk about the perioperative aspect. This wasn't just about what happened on the table, right?
Correct. The researchers looked at the spontaneous speech before the surgery to establish a baseline, and after the surgery to track recovery. They found that by using this robust measurement, they could better understand the trajectory of a patient's language health. It helps in identifying the specific underlying language problems that occur as the brain adapts to the presence of the glioma and subsequently to its removal.
It's about the longitudinal care of the patient. For our medical students listening, remember that a glioma isn't just a mass. It's a disease process that infiltrates neural networks. This paper is pushing us to look beyond the static tests and move towards dynamic assessments.
Precisely. The abstract concludes that this analysis is not just a nice-to-have, but a vital tool that adds significant depth to how we measure surgical success. It bridges the gap between the clinical environment of the OR and the reality of the patient's life at home.
It's a call to refine our intraoperative protocols. If we can use spontaneous speech as a robust measurement, we're not just saving speech in the technical sense, we're saving the patient's ability to connect with the world.
A great way to put it. That's a wrap on this study from the British Journal of Neurosurgery 2026.
Thanks for joining us on the Neurosurgery Hub podcast. We'll see you in the next episode.